what is the confusion about weight loss?
Yeah, most people they really don't know what kind of diet they're supposed to be on, and so it's very confusing. And therefore, we try to simplify it and just customize eating plans according to each patient. There's different diets for different patients. For example, I like to put patients that have a situation where they have inflammation, autoimmune, things like fibromyalgia, fatigue, history of Hashimoto's, thyroid disease, anything that can contribute to inflammation. I put them on a specific diet compared to somebody that doesn't have that. Somebody who doesn't have inflammation or musculoskeletal type things, like lupus, rheumatoid. I put them on mainly like a Mediterranean diet, which is a pretty balanced diet, but it's a low carb Mediterranean diet. People with inflammation, I put them on an autoimmune paleo diet. It's actually a diet that eliminates the foods that typically can cause inflammation in those people. Because inflammation is what causes weight gain in some people, water retention, and inflammation decreases your metabolism. So we eliminate grains, dairy, legumes, soy, processed foods. We go through what we call elimination diet. We eliminate certain foods and then we can reintroduce them after a while, but keep eliminating certain foods that may be causing inflammation and weight gain. So that's a pretty interesting concept that a lot of people don't understand. Most people think calorie in, calorie out. You know, it's not as simple as your doctor telling you, "Oh, you just got to eat less and you're going to lose weight." That's not necessarily what happens. We are what we eat. So at New Age Medical, we customize eating plans based on the patient's needs, food sensitivities, metabolism, and whatever is going on with their body. So, with our patients that have diabetes or metabolic symptoms or they're pre-diabetics, I put them on some type of ketogenic diet, which is a diet where people go into ketosis and the way you go into ketosis is by burning fat as fuel, not carbohydrates. So we limit their carbohydrates to very little, like maybe 10%, 5 to 10%. And then most of it is based on fats, good fats, protein, and we can develop an eating plan based on those needs for those people. We're seeing a lot of people with, fatty liver. That's due to insulin resistance. Right now, fatty liver is really on the list of number one things that cause liver problems or liver failure. It's not alcohol anymore. It's not hepatitis, like hepatitis B or C. It's actually metabolic. It's due to fat deposition on the liver due to insulin resistance. So those people, I'll put them on a ketogenic diet. So as you can see, we can customize the eating plan based on the patient intake, like with their family, with their history, is their family history, what's going on. So it's not as simple as just putting somebody on a calorie restriction and expect people to lose weight, because there's plenty of people that you can put them on 1,000 calories a day and they lose weight for the first couple of weeks and then they stop. So, and we go as far as testing your blood type too, and your blood sensitivities, so which are antibodies to certain foods, to figure out which foods may be causing issues with inflammation and weight gain. So we can really customize the eating part of it. And that's what I like about doing this. And just last week we had a patient with Hashimoto's, fibromyalgia, problems with her thyroid, obviously with Hashimoto's, a lot of fatigue, muscle aches, and we put her on the autoimmune paleo diet, and that's all she did. She told me she couldn't take like appetite suppressants because she's had reaction to those in the past, and then less than 6 weeks she has lost about 20 pounds, and it's amazing.